right, hi there.
Hello, hello.
This is Dr. Garani with Taisha here, our office manager, and we are going to do a live today, so let us know if you have any questions, and we would like to answer them as best as we can. So go ahead.
Hello, welcome. So, Doctor, we'll get started with a couple questions our followers already left us, okay? So we'll start with this one, which is a great question. I guess some patients don't really know what a cell saver is, so can you elaborate more on the cell saver?
Okay, so cell saver is a device, a machine. It's actually a pretty good sized machine that we've adopted into our practice here, and it's used in orthopedics, it's used in cardiac surgery, and what it basically does, it separates your own blood, and it's done in a closed fashion. So when we do lipo, we get fat out, but inadvertently there is some blood that comes out to certain degrees and to varying degrees depending on the patient. So that blood is then allowed to settle. The fat floats, the blood and fluid goes down. We siphon or suction that fluid into the machine, which is a closed system, and that goes through a different series of filters, and it's spun down like it's done in the lab at high speed with different lights to remove impurities, dead cells, and any fat that might have entered through the filters. And then that is concentrated and placed in a IV bag, and that is then given to the patient. It's your own blood. It never sees the air, and it is a closed system, and it's sterile, and it's given back to you through the vein. So it's your own blood with your albumin and all the proteins that you have in your blood that will allow you to have better oxygen delivery, and also it's a volume expander, so it makes you feel better after surgery. And again, like I said, it's your own fluids, so it is really safe, and I really recommend it.
Alrighty, so this is a common question that we always have.
Good.
Why not answer it one more
Sure,
time?
one more time.
Is there a BMI required?
Okay, so guys, on an outpatient clinic like ours, this is an outpatient surgery center sanctioned by the state of Florida. The limit is not to go above 40. So your BMI has to be 39 and below for you to qualify to be here. Otherwise, you have to go to the hospital, and most of us really don't operate at the hospital because it's not really cost effective. So BMI is 39 and below.
Alright, so I have maybe a future patient here asking, how many days should I expect bleeding after surgery?
Okay, so people bleed to different degrees, and depending on their hematologic status. But I don't like to call it bleeding because the active bleeding kind of stops almost immediately after surgery. This is a lot of fluid mixed with your own blood that is there. Usually the blood is, it's blood colored for the first
couple days.
Maybe a couple of days, maybe maximum. Okay, usually I've seen it clear up by the first 24 hours, and it goes more towards straw colored fluid. Okay, and that's just fluid that is being released from broken down cells, swelling, fluid that's around cells. So that swelling lasts a long time, and that's why I keep my incisions open. I don't put drains, and I ask you guys to please stay here long enough and come to our clinic, because we are experts. We have trained our staff on how to make sure that fluid comes out through the incisions that I use to do the lipo. It's really crucial, especially in lipo, because you can get these different pockets, because lipo is not one continuous space. It's multiple different tunnels that we create with the cannula to remove the fat that you guys can't see because we're working through small holes, but those areas can trap fluid. So if the massage therapist does not coax that fluid out or try to direct it to the holes and towards the lymph node, you'll collect a seroma. And your lymph nodes in the armpits and in the groin take a long time before they can keep up with the amount of fluid. Just think of it as when the city floods because of a lot of rain, the sewer system and the manholes they overflow and they cannot keep up. So we need to help the body get rid of that fluid, and the best thing is to push it outside through the holes.
Alright, there you have
So
it.
we hit a few questions there.
Yeah, a couple.
I hope that helps. So please, let's see more questions, more fun questions, guys.
So we have here, how soon can I do a round 2 after a BBL?
Okay. I really like you guys to wait at least a whole 6 months, maybe a little bit more. And the reason being is the swelling from the first case that you had lasts quite a bit of time. And the more massages you do, the better you will feel, the softer your tissue will feel, and the swelling will be better. So if you're really thinking of a round 2, please do not give up on your massages and keep on doing them yourself and with your massage therapist.
There you guys have it. We do have someone asking us where we're located. We are located here in Miami, Florida. Alright, so here, do you do a breast lift,
Absolutely.
an augmentation, Lipo 360, and fat transfer all in one surgery?
Okay, so the only thing that I don't combine with BBLs, let me rephrase this.
Yeah.
I do breast surgery. I do breast augmentations, breast lifts, tummy tucks, body contouring procedures, arm lift, thigh lifts, all the body contouring procedures you can think of. Okay? Now, the one thing I don't like to do is a tummy tuck or a mommy makeover, which is breast and tummy, along with a fat transfer. I will do lipo with a breast augmentation, a breast lift. I'll do lipo with a tummy tuck. And I have to be careful when I do combine a tummy tuck with a lipo, because we don't want to damage the blood supply to the front of the abdomen where we're cutting the extra skin off. So that, we have to do a little bit of the flanks, the love handles, we can do the upper back, but we can discuss that. We can do arms, we can do inner thighs. But the thing that I'm absolutely against, and here there's a big no, is I will not do a breast with a tummy tuck and fat transfer to the buttocks, because I think that's ridiculous. I don't think the patient needs to put themselves through so much high risk. 2 high risk procedures, BBL and then mommy makeover, and how in God's good name are you going to recover? Which side do you recover on? I know there's a lot of people testing the waters, I know there's a lot of people pushing the envelope, but my humble opinion, I don't think it's logical, and I've seen a lot of patients show up complaining that they're not happy with either the mommy makeover or they're not happy with the BBL. So what's the point to be in a hurry, because haste makes waste. So let's be logical, guys. We can stage some of these procedures. We can combine some. So if you have a question about me combining a procedure, please send it to the Instagram at GaraniMD or here at Icon Cosmetic Center, and we will tell you what I logically feel is safe for you, because safety is number 1, guys.
Yes. So I have a patient, asking, if I'm a bus driver, how soon can I go back to work?
Okay, it's really crucial that you take at least 6 weeks off. Okay, because now you have a BBL. I'm assuming that you're asking about a fat transfer. I mean, maybe I jumped the gun.
I'm thinking that too.
Okay, but I mean, if you have a mommy makeover, like a tummy and a breast procedure, you can go back to work in about 2 weeks, because you're not gonna hurt the tummy or the breast. But if you're doing a fat transfer, okay, you cannot sit on your buttocks for at least 4 to 6 weeks. And then when you start sitting, you have to use the booty pillow, which you have to put under your thighs, and you need something to support your lower back. Otherwise, you're going to fall backwards into the driver's seat, and you're just going to damage the work we do, and you're going to get flat spots. Now, if you do just lipo by itself, you can go back to work in a couple of weeks too. When you stop draining and it's not messy, and you always have to make sure that when you're going back to work, you're always adjusting that garment. You can't let that garment be on its own, because it will fold, it will wrinkle, it'll cause lines, because again, this is a static garment. It's not a smart garment. Okay?
Yeah.
Alright.
So let's see. Okay. I'm from Georgia, so out of state. After surgery, how long do I need to stay here in Miami?
So I recommend for a BBL and liposuction that you stick around after surgery for 7 days. Why? That will give you the opportunity. And we're not counting the day before when you come for pre-op. We're not counting the day of surgery. I'm counting from the day after surgery when you show up for your first post-op. And why am I saying 7? We get the opportunity to spend time with you, because usually everything we tell you before surgery, people will forget because of the stress of surgery. And the opportunity to teach you and perform massages, the proper lymphatic massages, which is in different stages. At the beginning, we're pushing a lot of fluid out. Later, when the body starts picking up the fluid, we have to redirect it under the skin towards the lymph nodes. And that takes a few days. So guys, don't be in such a hurry. And I want to say this out of the gate right away. We have 9 hotels around this clinic. We're very close to the airport, right behind us basically. You don't need a car, you can Uber here, book yourself in one of these extended stay hotels, get yourself a private duty nurse if you don't have family support, or even if you have family support, because that is so crucial. You can walk to the clinic from most of these hotels. There's restaurants, there's pharmacies, grocery stores, so it's very, very cost effective to stay close, because the flip side, when you go to recovery houses, which I'm not very fond of, you end up having to pay for Ubers because they don't want to transport you. You have these conflict of interests. Also, patients are kind of being coaxed and pushed to do all their massages with somebody else. And it's fine to do your massages with someone else when you go back home. We have no choice. But you have a chance, you have an opportunity to spend 7 days here with us in our clinic, working with my staff that have been working with me for a very long time, and I get to see you much more often, and we can teach you and make sure that your recovery is smoother. So that's why I look at it from a standpoint of your improved outcome. And so BBLs and lipos are recommended about 7 days after surgery, and then for the tummy tucks, because you have a lot of drains, at least 7 to 10 days. Okay, guys? All right. I hope that answers a few questions.
No, it definitely
and I'm not ignoring any questions. I'm here to answer them all. So please, you guys, whatever questions.
I actually have someone saying, thank you, Dr. Garani. Having a BBL with you was the best decision I ever made. She loves her results.
Thank you. You know, I'm very proud to say that a lot of my patients are word of mouth. I get referrals from people that are, for example, I get a lot of patients from Jacksonville, because a lot of people in Jacksonville have come down to me, and it's just a snowball effect. They refer to each other, and from throughout the nation, I get it from California, up north, Midwest. So word of mouth, I'm very happy with. I thank my patients for their loyalty and their follow-up, and you know what? Thank God for all the blessings we have. So
yes, exactly. Amen. So, do you do HD lipo?
Okay, high definition lipo, yes. High definition lipo is basically when somebody is in good shape and they work out and they're very close to their ideal body weight. Yeah, we can achieve a lot of fat removal, and it will expose structures below that, like the lines in the groin where the muscle meets the groin, the six-pack, the lines, mainly the lines on the side here and the line in the middle. So yeah, you start seeing landmarks that are below the skin, but that's really more for people that are very close to their ideal weight. Okay, not so overweight.
I do see a question here. It says, "What's the difference between a regular BBL and a skinny BBL?"
Okay. It's just your BMI and how much. The technique is still the same. I will always be able to. I mean, unless you are really skinny, like basically skin and bone, I can find fat on pretty much everybody. Typical areas that we find fat is the stubborn love handles down here, the area around the belly button. That seems to be the areas that most human beings collect fat, even if they are in good shape. In the armpit area or underarm area, arms sometimes. So it's just basically based on your size and BMI. So, and some people are not comfortable with that. Some people turn patients away because they don't think they have enough fat. And what really irritates me, and I'm going to be honest, is when patients come to me and say, I was told to gain weight. I don't think that's good.
Yeah.
Because if you live at a certain weight and your body's happy there, gaining weight is not healthy. You're going to lose it, and it's actually going to end up going away from your buttocks. We already struggle with fat absorption. And you know, with my technique, I've been able to see good results and fat staying and not going away. But especially with the skinny BBLs or the girls that don't think they have enough fat, consult with me. Send me your pictures, because I rarely ever recommend anybody gaining weight. I'm actually pushing people to lose weight, okay, and get really healthy. And then for the secondary BBLs, Remember, if we do, or somebody else does a lipo, and they've cleaned up the anterior abdomen and the flanks, and you still want more, and you think you have to gain weight, guess what? The fat is going to go into areas like the intra-abdominal fat, the visceral fat, and I can't get that. So you can actually get central obesity, and you don't want that. So try not to gain weight. We'll look for somewhere else, like the inner thighs, for example. Okay?
Right. So here, Krisha actually said los mejores, the best. Ave Ste, Dr. Ronnie is the best. Again, so I see a question here. It says, do you do J plasma?
Yes. I do J plasma.
I'm not sure. Can you specify, I guess,
what it is?
Bit? Yeah, because the question is a little off here.
Okay, no problem. And we're not ignoring any questions. We're trying to keep up with them as they come up up on the screen. But so J plasma is very simple, guys. It is a helium gas that is delivered into a cannula or a little rod that has electrical current running through it, and when they come together, it causes a heat effect. And that heat effect heats up the tissue under the skin and allows those fibers that hold the skin to the muscle to shrink and remodel. And that's what the process is. It helps shrinkage of skin. Some people respond better than others. If your skin is really, really loose, then you understand where we're heading with this. After your lipo, you need a body contouring like a tummy tuck. So, I think it works if it's chosen for the right cases. Again, when I see you, or I see your pictures, or I see you in person, which is better, I can give you that advice. So always come with an open mind, because there's always things that when it's in person, it is the best possible chance for me to give you the closest to an ideal treatment plan. Over pictures, it's good, but it's not the same.
That is very true. So I have another one. Will another round make fibrosis worse?
Every time you have lipo, you're gonna get scarring. Okay. One thing that I have found, that patients that are very obsessive compulsive with their massages and follow my instructions, when I tell them that you can massage yourself, you can do your flanks yourself, you can reach your love handles yourself, those patients that combine a massage therapist, they come here and they learn from us how to do massages, and they do their own massages for, I'm talking about 6 to 9 months, they rarely get that fibrosis. But then if you're slacking with that, it happens. So yes, the more rounds you have, the more scarring, because what are we doing with plastic surgery across the board? Whether you're doing a breast procedure, tummy tuck procedure, or even liposuction where the scar is under the skin, we're trading a very nice shape for scars. We have to use scars, we have to create scars to get better shape. Some of them are hidden, some of them are not. Some of them are felt, but not seen. And that's the fibrosis, guys. So the harder you work with your liposuction, the better your fibrosis is going to be.
Alright, let's see here. I'm trying to read one off of it. How long would you recommend taking off from work for a BBL? Okay, so we did talk a little bit about this one a little earlier.
At least 2 weeks, guys. At least. It's going to be rough for you to go back to work, especially if you're sitting down for your job. If you can stand up, I encourage you to go back to work with compression socks and walk around. You just have to take frequent breaks, fix your garment, get massages frequently.
Alright, so do you use the ultrasound when doing the BBL to avoid
Absolutely. Absolutely. We don't do anything without it. Okay? I was using the ultrasound before the rule came out that we have to inject under ultrasound guidance. I think that is a very valuable tool. The ultrasound, if anybody has been to the OBGYN and they saw an ultrasound of a baby, for example, that's the same thing. It's just a smaller device that we use here for our practical purposes. It's in the field, it's wrapped in a sterile pouch. I'm using it as I'm working. Sometimes I even use it before I inject to survey the buttocks to see if there's anything unusual. We look for anomalies, we look for things. Sometimes when we're lipoing, I use it. It gives us an insight, it gives us a window to below the skin where we cannot see, that we only feel.
Alright. So I do have actually a good one. So, do you do online consultation?
Yes, we do virtual consultation, time permitting. Usually we're in the OR, we just happen to be done for today. But yes, so if you guys call the office, we have the front desk person, we have the team leader here that can interface with you, and then my nurse can call you, figure out a good time, and then when she can find me between cases or between seeing patients, I can sit on the phone with you and give you an efficient consultation. So have your questions ready, be in a place with good lighting, try to not have a window behind you so that we doesn't blur out the picture. It makes it difficult for me to see, and I'll be more than happy to do these consults.
So we did answer this question on our last slide. Is upper back included with Lipo 360?
No, it's not, guys. You know, there's so much that we'd like to do for you guys, but remember, you know, there is a limit to how much we can include in one package. But the Lipo 360 starts right below the breast, from the fold, from the xiphoid right here, down to the private area, or right above the private area where the bikini line starts. The love handles, the flanks, up to the bra. Now, above the bra, the armpits or underarms, upper back, those are extra areas. The arms are extra areas.
Okay.
And it really helps to do the underarms and the upper back because you don't look as wide and you can make that hourglass look nice and fine.
So I do have here, this one's also for the fibrosis. I think we talked a little bit about it,
No
but
problem.
this patient says, I have fibrosis, but going to round 2 BBL, can fibrosis be removed or can I add something else?
No,
to remove it?
it can't really be removed. What we try to do, what I've been trying to do is try to break it up again for you so you can start all over again with massages. I do have the Vaser device. The Vaser device is basically a stick that I can use to liposuction and break up the fibrosis. It's ultrasound. It's an ultrasound energy that's transmitted through the cannula, and you can't hear it, but it raises the ability of the fat to break down, and it also has a side benefit because it raises the temperature a little bit. It can, that's what I was trying to say, it raises the temperature a little bit and it can cause some skin shrinkage, but I also use it to negotiate very hard areas.
Alright, so let's see.
What does that say?
Look. Oh, no. Okay.
Look at the
It says, do you use the syringe method or vacuum pump assisted method when injecting?
No, I don't use the syringe method. I think the syringe method can be very, I used to do it in the past, and I think that by using the plunger and pushing with the palm of the hand, I think that generates a lot of pressure at the tip of the cannula, and I don't like that. I use low pressure, continuous injecting with a delivery system that's basically suctioning the fat, not suctioning, but removing the fat by siphoning the fat into a cannula in reverse. So it's the same device that I use to remove the fat. I just reverse the flow from the bottle into the cannula. I think that is, I can control the speed, I can control the pressure with where it's coming out, and I think that's safer, and I like to move while I'm injecting. So small little drops of fat, I can create a more even outcome as opposed to dumping. And why I don't like dumping? Because you get a clump of fat, and I think it decreases the survivability because that amount of fat does not get enough blood supply to it. But when you're constantly moving, it's safer under low pressure, and you're dropping fat in small little aliquots, and that makes it more homogeneous, and it will improve the access of the blood vessels to the fat. So that's my technique.
All right. So one of our patients that asked the question about the fibrosis, she said she has a camel hump. Can she add that?
Sure.
To the
The dorsal hump up here below at the bottom of your neck, that can also be postural, like the way you hold your neck forward and you slump down. So try to make sure that you go to a physical therapist, or you get a hold of some videos online on how to improve your posture and see if that improves it. Now, if you think that is really fat, then absolutely more than happy if I see you and you're here in person, and we can address that.
Yeah.
Now, one last thing about that, so it's posture that makes it very obvious. Also, the skin in that area is very thick, and it's very, very dense fat. So, but again, if I think that it's feasible, I think that there's fat there, I'll be more than happy to go up there and access that area and clean it up for you.
Alright, so can you use arm fat for a second round BBL?
It depends if you have enough. Arm fat is not the best type of fat. It's very soft, but yes, I will use all the fat that looks viable and clean for a transfer.
So I do have a question here, although we did answer this one. How do you see baby do a tummy tuck and BBL? Not together.
No, I don't combine BBLs. The BBL is basically, for me, a BBL is lipo, and it can be from any area, the lipo, and fat transfer to the buttocks and the hip dips and stuff like that. But I will not combine that procedure that I just described with a breast or a tummy. I think that's too much, that's asking for trouble. I just never can imagine how the patient can recover when you have to sleep face down, then you have to sleep face up, or this. It's just, I think it's too much risk.
Alright, let's see.
And I'm not really impressed by the outcomes, to be honest with you. Some people get lucky, but I don't work on luck. I work on predictable outcomes.
Okay, so this is, do you turn away someone who has had a certain amount of rounds in the past?
Well, I don't like to use that word turn away.
Yeah.
Okay, the main reason I would say no to somebody is if when I examine them, I feel like there is no more room for improvement, or we have no more access to subcutaneous fat, and then we're up against the wall because all the fat has been removed. But I would look closely at your arms. I would look closely under your armpits. I would look at your inner thighs, and will give you the best chance possible. But that does not exclude you from, for example, a reshaping, where if you don't like the shape of your butt, we can do something along with a lipo, or using the liposuction technique to reshape a butt that you're not happy with, and move the fat around. But yeah, there's sometimes I've had a few patients in my career where basically the skin is right up against the muscle and there's no more fat there, and it's not right to just put them on the table just to make them happy and get no result out of it.
Right.
Or no improvement, I meant to say.
So yes, to answer this question, we do have specials going on. You guys can go on our page or pretty much give us a call. Alright, so Dr. Gurani is the GOAT. He did my surgery in 2021 and I still look great.
Thank you. Oh, so yeah, this is what I like to hear, that years and years down the line, so that goes to my point that with the way I inject or re-inject the fat, I'm getting longer lasting results. The patients are happy, and it's about how you place it and how you deliver it. You're not just dumping. I hate dumping. Even when I used to use the syringe technique, which really killed my thumb, I was never really pushing. It was always one hand and the thumb was doing it. So there's so much force you can put, not really with the thumb, as opposed to when you slam it down like that. So, but it took a toll on my finger, and I figured out another technique.
So I do have one here. What is the recovery like for a mommy makeover?
It's actually not that bad. I've done a few the past couple of weeks, and I like the way they recover. They wake up, it's different than liposuction. They might have a little bit of tenderness along the incision. Sometimes when we repair the muscle, they feel a little bit uncomfortable, but overall, it's not that bad. And I mean, my patients are walking around the next day, so, and I rarely have seen them complaining of that much pain.
So here, let's see this one. Okay. Well, she's asking, can I add the hourglass lipo to my surgery after already being booked or scheduled? So
yeah, call your coordinator, and the hourglass is basically, we're improving the shape of your back. Okay, we're looking at armpit lipo, bra line lipo, mid back roll, and love handles. And if we stay towards the back, from the midline backwards, it's safe for the blood supply. It's all about blood supply, guys. I will do lipo in chosen areas. We can add inner thighs, you can do arms. But again, it's all about safety and predictability and good healing and blood supply to your skin.
So I just see one here on our TikTok. Okay, so if I want only a lipo and BBL and with J plasma, not a tummy tuck, I think she's asking like if she just wanted that, but I think she needs a tummy tuck, right? Maybe she has some skin laxity. I would say send in your pictures.
Yeah, send in your pictures, but again, I have done liposuctions, plus or minus BBL, put that aside for a second. Liposuction of the torso on people that are borderline and they're not sure they want to go through a tummy tuck, or we're not sure how the skin is going to respond, and we've been surprised. We combine J plasma with it, the skin shrinks very well, they do a lot of massages, and lo and behold, they're happy, even if they have a little extra skin, but they're happy because it's tighter, it sits better on their abdomen. Now, if you have a lot of skin, depending on how it sits and how the fold is, sometimes I will allow patients to capitalize on getting the lipo and the fat transfer, and we'll give them a nice shape to get a good waist, but then they still get that area in the front that is still with excess skin, and they have to come back in 6 to 9 months to get a tummy tuck. Sometimes you can't have it all at once, unfortunately, because it's unsafe, but I think that there is room to do a liposuction on somebody that has extra skin, and with good massages and good follow-up, they can get away from having fluid collections, and then we can live with that for 9 months and see how the skin responds. And if you're happy with your shape, then don't worry about it. You just send us your glamour shots. But then, if you're not happy with it, then we do a tummy tuck.
So I think I did see one on there. We did answer that one. So it says here, would you do a BBL and breast the same day? Again, guys, we answered this one. BBL and breast the same day.
No. BBL and breast. I don't combine anything with BBL. No. Tummy tucks with breast, yes. Tummy tuck breast and some lipo, yes. But fat transfer, no.
Okay.
I'm talking about to the buttocks.
Yeah.
It's dangerous, guys. How are you going to recover? What are you going to choose? What are you going to prefer? Your tummy and your breast over your butt, or your breast over your tummy? That's an incision. It's a big incision. It could open up. You sleep on your abdomen and you put pressure on your new breast. You can disrupt the incision. You can have the implant come out. You can damage the blood supply to your nipple to protect your butt. And if you want to protect your front surgery with all these big incisions, the anchor and the big smile incision, then you're damaging your butt. So help me think through this. I think logically it just doesn't make sense to me. And I know a bunch of surgeons allow it, and all the power to them and to their patients. It's a personal choice. In my opinion, in my professional experience, I don't think it's a smart idea.
So she's actually asking what a mommy makeover, what is included. So it's Steve.
A mommy makeover has many different iterations, but it's a breast procedure and a tummy tuck, guys. So the breast procedure can be an augmentation and a tummy tuck. A breast lift reduction with a tummy tuck. Different combinations of breast and tummy.
So, okay, I live in the UK and would like to travel for a BBL. It's a long flight, would that be okay?
So you're not the first one from the UK. Let me tell you, there's a lot of patients that come from the UK. Miami to London Heathrow is about 8.5 hours. Coming here is obviously fun. You're coming to Miami, but then on the way back, I really recommend you stay here a minimum of 7 days so that you can be well hydrated, well recovered before you go back. And then you're gonna have to learn how to use the booty pillow and the back pillow, and probably try to get yourself maybe a good deal on the business class ticket. You're gonna have to walk, you're gonna have to hydrate. We give you letters to help you with the flight attendants at the gate and on the flight. And usually, from feedback from patients, the flight attendants at the gate and on the plane have been very kind.
Okay, so are there precautions put in place to prevent infections from anesthesia, intubation, or just infections in general? Okay,
so infections from anesthesia, that's a completely rare entity. I've barely ever seen it. If anybody gets an infection, it's because they probably have an abscess to start with in their mouth or something like that. But from anesthesia, no, there is no infections from anesthesia. But infections, when it comes to breast cases, tummy tucks, BBLs, they're rare, but it's a risk that we have to consider So it's anywhere from 1 to 5% of cases where you can get an infection. How do we take precautions? Well, we ask you guys to shower the night before and the morning off with antibacterial soap, Hibiclens, which is chlorhexidine, and we also prepare you. So when you go to sleep, before I get in to operate, my assistant is prepping the area of surgery with either betadine or chlorhexidine, which are antiseptics, and we allow that to dry for at least 5 minutes so that there is an effective killing concentration, so that you can damage as much of the bacteria that technically lives on the body.
Yeah.
And this room is turned over after every single case and really cleaned down with disinfectants. The bed that we're sitting on, again, cleaned up with disinfectants, and it's sterile drapes. We have sterile drapes above and below you, and every time I do something, I'm changing gloves, I'm wearing sterile gowns. We try our best to do the standard of care.
So let's see here. Doctor, do you operate on people with high blood pressure?
Controlled high blood pressure. If you're a hypertensive, documented hypertensive, just make sure that you measure your blood pressure for a long period of time and keep it on your phone, keep a log. And if your blood pressure is normal or within acceptable normal limits, then yeah, why not? That means your medication regimen is effective. If you find that your numbers are off, go back to your primary care physician or your cardiologist and have them change the medication or increase the dose.
So we're gonna jump onto this question here. So will getting a Lipo 360 leave me with loose skin?
Lipo 360, you can have some loose skin, but again, I've seen the whole spectrum. We're talking about people that come out the next day where their skin is like a rubber band, like perfect. They don't even need a garment, you know. And then I've seen the other end of the spectrum where the elastic fibers and the collagen fibers that some people have are weaker than others, and yes, they stay with loose skin. There's always an amount of tissue retraction, shrinkage, after you remove such a volume of fat. But again, we can't predict all of that. We can guess sometimes who's going to do better than the other, and I'll be more than happy to help you with that. You know, when you send me pictures or when you're here in person.
Okay, so let's see here. Dr. Veroni, quick question. I have a BBL and want a reduction. You cut the skin to reduce the butt?
No. So if it's just fat that was injected into your buttocks, hopefully, then you send me pictures, front, back, and sides with your arms up so I can see your buttocks from 4 different positions. We can lipo it. So if you had a butt augmentation with fat, and hopefully your skin is in good shape, we can shape it for you. We can remove some from some areas that are excessive and are out of contour, out of harmony, and put them in other areas where they might be flat. So yes, we can reduce it in size if it's nice and just too big, or if it's not pleasing to you, you can reduce it and reshape it. Yes, we can do that.
So I'm going to answer this one generally. She did ask how long is it for skin BBL, but how long is it for a BBL procedure?
How long
is a BBL procedure?
Okay, so a BBL procedure, depending on the surgeon, depending on your how the patient's skin feels, because some patients under the skin they have more connective tissue and it's harder to lipo. So everybody's different. Depends on your ethnicity, type of skin, prior surgeries. The more surgeries you have, the more scarring you have below the skin. So typically it can take anywhere from an hour and a half all the way to about 3.5 to 4 hours, depending on how many parts we do. You know, if you're doing arms, you're doing chin, you're doing, but a basic 360 lipo with fat transfer takes me about two hours, So, but I'm not here to look at the clock.
Yeah.
I'm here for your safety, everything done in a methodical technique. I have protocols and we go by that. We're not wasting time, and we just do it at the pace that I need for that particular case. Alright,
I see someone asked this question twice. So we did answer this question, how long should I stay in Miami after a mommy makeover?
I would like at least 7 to 10 days. I would like to get you to a point where you're independent and hopefully remove the drains, but you know, the longer you stay, the better for us and for you. We can teach you a lot.
Alright guys, if you guys have any more questions, we'll go ahead and answer one last question. I think I see one here. Right after that one, so this last one that we have here, can you do lipo to remove fibrosis? We did answer this one, but
we can lipo again. You know, obviously I have to look at your pictures and even better feel your skin, because I can tell a lot from examining how hard the scar is under the skin. I do have in my cabinet, I have the Vaser machine. That's the ultrasound assisted suction cannula, and that helps me to a certain degree break through scar. But yeah, we can help it. I've improved it by going in there, using the ultrasound and breaking it up again and making it look better, less bumpy, and then we really encourage you to go and get more massages. But in some cases it is impossible to get through, especially if the patient has been thinned out so much that you're talking about just basically skin, dermis, and straight wear on the muscle.
So we'll answer this last one because she did ask
Sure.
it twice.
Sure.
Hi, Dr. Durrani. Do you offer tailbone fat removal?
Tailbone fat removal.
I don't know what you mean.
Listen, if it is in an accessible area, then by all means, you just have to show me where, and if I think it's safe, I'll be more than happy to do it. They're probably talking about in the sacrum area, where they're not talking about the tailbone itself, because that's really lower in between the buttocks crease. But they're probably talking about the triangle right above the butt. Yes. Okay. I try to restore harmony. You know, the hourglass shape, the flaring into the hips. So to do that, you really have to go and clean up the lower back, the mid back, the flanks, the bra area. So it's a complete picture. I don't like spot lipo. You know, you have to kind of blend it in together, otherwise it looks odd. You know,
Yes.
you have a thin waist that I see on a lot of patients that come here. A thin waist, a thin torso, kind of up to the bra line, and then a lot of fat under the armpit and in the arms and other areas, and especially on patients that are a little bit overweight, that seems to be the case. So think about adding the underarms, and don't wear corsets. They make it worse.
Yeah,
they push the swelling into the armpits and down into the waist, and they mark you. So,
I've seen it.
yeah. And again, I apologize if I go off topic a little bit, but one question leads to something else, and I want to tell you guys as much as possible, educate you as much as possible, so that we can stay safe, and you know what, we can help you make a decision on where you want to go, and hopefully you'll choose us.
Well, Doctor, thank you so much.
Thank you so much for your time.
Being live with us. Thank you
appreciate it.
guys. Hope to see you guys soon.
Have a good weekend.